Hi, I'm Dr. James Bissland. Welcome to Health and Information. This is January 2017. You know, as I was talking with colleagues and other people, patients, friends, family, it just seems like time is going faster and faster and faster, and our whole world seems to be moving at a faster pace. But anyway, we are in 2017, and I want to just talk a little bit about some of the things that we did in the last couple of months. Our last two programs were a little different, with the Miracles program in November, and then our author was here in December. So we didn't get to talk a lot about what's been happening here within the clinic over the past 2 months. But the events that we've had bring us up to this program, and we're going to be talking about what we accomplished with those in the second part of our program, as well as some other additional information. In November, we did a food drive for the DaySpring Villa, which is a domestic violence shelter here in Tulsa. And in December, we did a toy drive. And this year's toy drive was very unique in any that we've done before with either DaySpring Villa or our Christmas Crusade for Kids that we did before. And that is, this year we were working strictly on stocking stuffers for the children. And we have the community relations manager for DaySpring Villa going to be with us here in the second half of the program to discuss what's new with there in the last, I think, about 3 years since we've had anybody from DaySpring who's been on the program with us. So we're going to learn a little bit more what's going on with them. They have some new areas of the facility that are open now, which is going to be allowing them to help more people. And it seems like we need more and more help in that area. You're hearing more and more about that on the TV, on the news, with athletes and so forth with domestic violence. 2016, we had a big year in the office with some new additions. We put in the hydro massage table, which many of you have been able to experience. I've seen a great deal of improvement in a lot of health conditions by that addition that we were not able to accomplish before. And during our food drive and our toy drive, there were two for each drive, lucky people that won a 5 hydro massages as door prizes for our events that week. So those people have been enjoying that experience here over the last month or so. The other thing that we added during the year 2016 was digital x-ray, and I've been working on that for several years, trying to come up with the right kind of plan, the right device, and keep it cost effective, because one of the goals that we have here is we want to try to always keep all of our costs in line, our fees in line. Especially now, we're not sure what's going to happen with insurance over the next several years. We're not sure what's happening with deductibles, with co-payments, with insurance premiums skyrocketing. So we're trying to keep everything where we can do our best care, which is the only kind that I'm willing to do, and make it affordable for just about everybody. Digital x-ray is valuable to our office for multiple reasons, and the most important reason is it's faster. Images are much clearer. What I can see on a digital x-ray is way superior to what we had when we used film. There's no chemicals, there's no processing, there's no going in the dark room, making sure that you don't overexpose a film by light. But more importantly than that is, once we have the image, we're able to, with a computer, to enhance that image, to have a better view, a better picture, a clearer picture of the spine, and then be able to go in there and, in millimeter measurements, very specifically analyze the different positions and distortions and so forth. That's something that we've never had the ability to do before. So I think that'll enhance our diagnostic ability And in the about half year that we've actually had that in the office now, I've seen a tremendous improvement in what I'm able to do in the diagnostic department, what I'm able to see on the films, what I'm able to show you as the patient, but more importantly, what I'm able to find out about the patient that I was not able to or would not have been able to before, which gives me a better opportunity to provide better chiropractic care, and that's what we're all about. So those are the big things that we did in 2016. I had somebody ask me the other day, well, what are you going to do to top that in 2017? And right now I don't have an answer for that because we're kind of in a holding pattern with a lot of things because of the Obamacare. We don't know what's going to happen with it now. You know, we've had an election. We have a new president coming in. And some people think that's a good thing. Some people think that's a bad thing. We don't know what it is yet at this point. We don't know if it's going to help our insurance situation. We don't know what's going to happen with health care. The only thing I can tell you is that whatever happens on there, we're always going to be here. We're going to be on the leading edge, as I have always tried to be. And we are going to always make care available and affordable to just about everybody that needs the care. Now, during 2017, we are going to be celebrating our 22nd year in Tulsa, so that'll be happening this year. We will, of course, do our standard food drives and toy drives as we have pretty much done every year that we've been in Tulsa for one charity or a food bank, and now, of course, for the DaySpring Villa. Most of our insurance billing is still pretty much the same. One of the things that we have noticed, and I have had meetings with doctors from all around the country, and you guys as patients have probably noticed this as well when you get your copy of your EOBs, and that is that the allowables, what the insurance company allows on a specific procedure, have dropped significantly, and your co-payments as patients has gone up, as well as your deductibles. I understand some of them are going as high as over $12,000 for 2017. If you have any questions on that, you're always welcome to talk to Lisa, and she will be there to help, and she will be able to answer your questions. And if Lisa doesn't know the answer to it, there probably is very few people who do. But if we don't know the answer, we will find it. That is one of the things that we have always made sure that we've been able to do, is to find a solution, whether it's a healthcare solution, a financial solution, a referral solution, whatever the situation is, we will do our best to make sure that we can get that taken care of. We're going to take a break for just a minute, and we'll be right back with the Community Relations Manager from DaySpring Villa.
An accident can turn your life upside down. Immediately, you may face problems like who will treat your injuries? How will your car get fixed? What are you going to drive in the meantime? You need solutions now. At Benedict Law Office, the care you deserve can begin at your own home. No office visit is necessary, and you pay no fee if there's no recovery.
At Benedict Law Office, there are no problems, only solutions.
Call Benedict Law Office for your free consultation today.
Are you in pain? Then meet the doctor. Neck pain, headaches? Meet the doctor. Low back and leg pain? Meet the doctor. Arm, shoulder, and hand pain? Carpal tunnel syndrome? Meet the doctor. Injured in an auto accident? Meet Dr. James Bissland at Bissland Chiropractic, where you can get your first visit free this month. Call Bissland Chiropractic at 838-4252. Bissland Chiropractic.
Where were you when the lights went out? Who did you call and when you gave them a shout? Did they pick up the phone? Did you get a machine? Or some front office drone? You know what I mean. You wanna talk to somebody who knows what they're talking about. So call Marie now. Electricians with a mission will get you connected with Marie Electric.
this is Larry Murray with Murray Electric. We appreciate your business and we don't take you for granted. While nobody likes to have electrical problems, we want you to know that we will be here for you when you do need an electrician. And remember, you don't get phone shuffle when you call Murray Electric, because we have a real live electrician that answers the telephone. Remember, if you're in a hurry, call Murray, 918-835-9605. 918-835-9605.
Get you connected with Murray Electric.
Welcome back to Health and Information for January of 2017. With us today, we have, as I stated before, the Community Relations Manager for the DaySpring Villa. And everybody has asked me, well, what is DaySpring Villa and where is DaySpring Villa? And I'm going to let her answer those questions because that's, number one, that's her job. And number two, she knows it a whole lot better than I do. So would you welcome Kendra Hollenbeck? As I said, she is the community manager, community relations manager for DaySpring Villa. And Kendra, thanks for joining us.
Thank you for having me. You asked me when and where DaySpring Villa is.
Yeah, let's talk first about what is DaySpring Villa.
Okay, DaySpring Villa is a shelter for women and children who have been victims of domestic violence, sexual assault, or human sex trafficking. We are able to provide for the ladies a safe place to stay with your all's help, 3 meals a day. Also a case manager who helps them work on their goals, helps them decide maybe they need to go back to school, maybe they should apply for a job, what the next step should be in their life. And we also help them get counseling for them and their children as they start on this healing process.
Okay, so now, is it just women and children, or are there any men that are in the program at all?
No, only women and any male children that they bring with them.
Okay, is there an age limit for the children?
There is not. Just 17 years old. Once 18, if a mother comes in with a daughter who's 18 years old, we take her in as a guest as well. But children 17 up or 17 and under. 17 and under. Okay. Now, I think I know the answer to this question, but we're going to ask it anyway because everybody asks me, and that is, where is DaySpring Villa? Where is DaySpring Villa? Well, I can't tell you.
So we'll put you in the GPS, right?
Yeah, don't put us in the GPS.
Where will it take you?
It'll take you maybe in a circle, maybe to the police station. That happens sometimes, so make sure not to put us in the GPS. We are in the Tulsa area, and we do serve all of Tulsa as well as their surrounding areas.
Okay, now how is DaySpring Villa funded? Because obviously, most women who are involved in a serious domestic violence, they don't have the funds to go out and live on their own. So how are you all funded to be able to afford to provide shelter, food, and the services for these families?
Well, that's a great question because, like you said, the ladies who come to stay with us do not have the funding to start a life new for themselves. In fact, a lot of the time, that's why they stayed in the situation they were in for so long, because they felt like that was the only way they could provide for their children. So we are a faith-based organization, so we do not get any government funding. All of our funding we get from organizations, churches, and individuals.
Okay, so tell us about the facility. And then, now, we've had the opportunity of touring that several years ago, and I know there's been some changes since then. But tell us a little bit about the facility. What can a woman who comes to you, what can they expect? What do they see in the facility?
Well, our mission statement is to provide physical, emotional, Christ-like care for all the ladies and children who walk through our doors. So as soon as they come in, they're greeted by a guest advocate who will first ask them, is there any food or drink I can get you? We don't know how long it's been since they've eaten. And then we help them get started on paperwork, where we find out what their needs are and how we can be most useful to them. Also, so to be able to meet their needs, we have a dining hall. We have a commercial kitchen certified by the Oklahoma Health Department. We also have a library, a rec room for the kids, a living area and TV room for the ladies. One of our new favorites is an art room. It's a lot of fun. We also have a chapel and counseling room.
Okay, now when there was a new wing you were telling me about that is open, what is the new wing?
Yes, in 2016, we were able to open a separate wing for our human sex trafficking victims. It gave us 11 new beds so that our maximum capacity is now 66 women and children. And we are able to provide for them a much quieter environment to recover in.
Okay, now I know that the counselors that work there, they all, of course, are trained to give these women the counseling that they need. They're trained to recognize when things are not right. Now, the sex trafficking thing is a new one. That's something that you guys have started, as you said, just this year?
Well, we became certified in 2012 to help human sex trafficking victims, and it's taken us about 4 years to get a wing open. Before the wing was open, we could help maybe 3 or 4, and now we can help more like 7 or 8, which is great. The need is there.
Have you noticed that in the last 5 years or so, has there been an uptick in domestic violence? Is it something that's on the rise now in Tulsa County, or is it pretty much stayed about the same?
That's a really good question. I have only been working at DaySpring for a couple of years and was really unaware of the situation of domestic violence in Oklahoma. I don't know if it's gotten more, but I know that it is so prevalent. 1 out of 4 women is a victim of domestic violence. So that's almost 1 out of every 4 or 8 people you meet is a victim of domestic violence, and I think it's 1 out of 7 men are victims of domestic violence. So I don't know if it's grown, but it's definitely prevalent, definitely a need for help for the victims.
Okay, now let's talk about somebody who is in need. How do they reach out to your services or your facility?
Absolutely. We are a crisis call center, which means 24 hours a day, 7 days a week, we have an advocate ready to answer the phone to anyone who's in need. You can find our number, of course, on our website. A lot of how our guests find out about us, that's what we call the ladies and children who come to stay with us. They're our guests, and most of them find out by word of mouth. We have a pamphlet here, and it's got our number on the back. So this is just as simple as it being here in your office, or maybe one of your patients picks it up and carries it around until they find someone who might need it. A lot of them find out that way from family or from friends. And we're also on a lot of reference sheets at the day center and places like that where the homeless first gather.
Okay, so if 1 in 4 women in, let's say, Tulsa County or the metropolitan area here are victims of domestic violence, that means that we all know people that are victims and maybe not even be aware of it.
Absolutely.
So, okay, you give this, and we have some brochures here in the clinic. If anybody needs them, they'll be out on our brochure area at the entryway. But they call this number on the brochure?
Yes.
Okay, so we can give that number out on here then.
Oh, absolutely.
Go ahead and...
It's 918-245-4075.
Okay, and that number will be on the screen as well.
Oh, wonderful. And you can call if you need services, if you just have questions about our services, or if you would like to donate or volunteer.
Okay. I know you had I guess either you've taken over the position or they gave you this assignment now. But we have been working with Susan Cox for years,
Yes.
and she was our contact over there, and was able to arrange, as I said, for us to go see the facility. And it's a nice facility. It's very clean. The employees there, the people who are there for the women and the children, are just seem like they go out of their way to be there. They've been over backwards to make them comfortable. And, especially during the holiday season, which we just had finished with now, that's got to be the toughest time, especially for the children.
It is. For a lot of them, they don't know what their life is going to look like next. But luckily, Christmas and the holiday season at DaySpring is really a wonderful time. Because so many people just like you all have donated gifts for our children. And that's not just a gift. When you donate a stocking stuffer, the child doesn't only see the stocking stuffer, they see that someone cared enough to donate that for them. So sometimes for our kids, being at DaySpring at Christmas means they get to decorate a tree for the first time. Means maybe that's their first turkey dinner. And maybe their first time to see and get their picture taken with Santa Claus. And all that is made possible because of our generous donors.
Okay, now, so somebody calls you, and like, for instance, today, somebody called you. Do you have any openings now, or is there a waiting list?
We do not currently have any openings. We stay pretty full. How it works is once a lady calls and gets us her information, she just continues to call us each day. And as soon as we get a bed available, we get her in there. And if we do not have a bed available, we will call other shelters for her until we find a safe place for her to stay.
All right. So when they come into you, what's the average time, or how long is somebody allowed to stay there at the facility?
One of the wonderful things I love about DaySpring is the women who come can stay as long as they're working on their goals. As long as they're meeting with their case manager and moving forward, they can continue to stay at DaySpring. For some, that can be just a couple of months, if that's all they need. Others may come in, especially for our human sex trafficking guests, they may need to come and stay a year. And we are here for them through this long healing process.
And you hear more and more and more about sex trafficking now. I don't know if it's becoming more prevalent or if we're just hearing more about it.
I think that may be the truth, that it's just coming into the light. And something that surprised me as I started working there at DaySpring Villa is the connection between domestic violence and human sex trafficking. Sometimes they started out being trafficked as a child, and because of the emotional distress that put them in, they ended up in a domestic violence situation as an adult, or the opposite happens as well.
Okay, so now you said the women who were there, they get the counseling. How about the children? Do they get counseling as well?
Absolutely. About 5 or 6 months ago, we started partnering with a Christian counseling agency, and they are bringing their counselors in to our shelter to meet with our women and children. It is amazing to see them meet with mom and children together to heal some of those relationships that have really been hurt by the abuse that they've been through. So our kids are really starting to heal, and it's very exciting.
Well, that is exciting, because so many of the times the kids feel the guilt that the same as the women do. But sometimes I've met with several kids who have been, the victims of the domestic violence through my years in practice, and the kids feel like it was their fault that they had to move, or it was their fault that mom and dad had gotten into it, and even though as adults we know that is not the case, but kids see things so differently than we do.
Yes, there's a lot of misplaced blame that happens for sure. That's just one of my favorite things about getting to be at DaySpring Villa every day. I get to see those kids, wrap my arms around them, and let them know that they are loved, that they are important, and that it's not their fault.
Well, that's great. Well, I thank you for taking the time to come out and kind of update us on what's going on there. As I said, it's been several years since we've done that. And we want to thank all of our patients who made the donations for both the food and the stocking stuffers for Christmas. We had an exceptional turnout, especially for the toy drive this year. And I was real pleased with the results that we got from those. And I know that everything that these, especially the kids, the holidays, we kind of like to think about the kids more, that even the mothers, it's important for them too, but the kids are the victims. They're the innocent victims.
Yes.
And that's why we always felt like we wanted to do something that was going to benefit the children. The toys seem to be the best way to do it, and your staff and your office has been really great in telling us what you need, what the donations would be the most beneficial, and that's what we're trying to accomplish. So we want to thank you for your time tonight and what you do for the community. I don't know that enough people know what you do to say that very publicly very often, but I think it's an amazing thing that you guys accomplished there, and it's a big need. And thank you for your time.
Well, thank you all for making this work possible.
And thank you all for joining us here for our first program of 2017. And you have a happy, healthy, and safe month, and we'll see you next time.